So welcome everyone once again, and it feels good to be back once again with you all. I hope you all are also excited to attend the class. How many of you are new? Those who have not attended my books to brain classes, can you just raise your hand, click on raise hand button. There is Balachandra, one person called Mokshaya. I think this is someone new. Only two people who are new. Okay. Priya, okay, Priya is new. Anisha has not attended live class. Okay, there are some 3-4 people. Okay, anybody would like to introduce me rather than me introducing myself, and why you have joined this class? Okay, 1 or 2 people. Anybody who wants to go and tell? Anybody wants to just tell why you have joined this class? Why you want to learn from a student? Yes, Lakshmi madam.
Good evening, sir. Good evening, everyone. So I have attended sir's class, I think since June 2022. Actually, initially I am
21.
Yeah, 2021, sorry, June 2021. And initially I saw 1 or 2 of his videos. Then the way he was approaching, it was quite good and quite convincing. First, all the basics he made us to understand first. And the class will be more of interactive section. Until we understand, and he gives food for thought, I can say. We start thinking, and he gives logical reasoning, everything he gives. Then he proceeds further. He never finishes the class thinking that he has to finish whatever he has thought on that particular day. So it will be very interesting, and all the basics, he will make us clear all the basics. So only when we are clear with the basics, and he proceeds further. In fact, some of the days, if I was outside, I used to use my mobile phone, and while walking also, some of the days I have listened to his classes, and I was really benefited from his class. And any question we can ask, boldly we can ask. He never any silly questions we ask, but he has got lot of patience to answer. Thank you. So I think all will enjoy the class again.
Yeah, I'll be the biggest beneficiary because I'll enjoy the classes most. Great. Thank you. Okay, so I have titled the course as TCM based tongue diagnosis level 1. Okay. So why level 1? So it means that there is levels more than 1. Okay. So level 2, level 3 may be there. Okay. The purpose of me titling in this way is that I wanted to make this. There is something called 80-20 rule. Okay, in management, etc., they use this. Okay, what it means is to understand something. Okay, 80% of something you require 20% of time. Okay, but to understand the other 20%, you require 80% of time. Right? So if you are trying to say clean your kitchen, okay, so mota. Okay, so that is on a superficial way. If you arrange few things, whatever vessels which are scattered here and there, you arrange it. You just clean the counter. Like little bit of work if you do, the kitchen will be decent enough to look at. Okay, but if you want to do a thorough cleaning, how much time you would need? You have to clean all the shelves, all the utensils, all the bottles. You have to clean the fan, the exhaust, clean the tube light, right? And mop the floor, everything. So it is a very long, detailed process. But I do not want to get into the detailed process at this point. I just want to teach this 80% of the content. What is there? That is, make you understand on a superficial level what all is there, so that I will not go into the finer details of things. Too many finer details. If I go now, it will confuse you. Okay, so that is why I will just leave away all those finer details, and I'll only concentrate on the basic stuff. Okay, so that when you see a tongue, you should be confident to make out few things. If not everything, you should roughly make out what is happening. Okay, so that is the purpose, and that is why I have named it as level 1. So if time permits or if things happen, we can take up level 2, and where we will go into finer details of this wonderful art, which is called as tongue diagnosis. Okay. So why tongue diagnosis? So there are so many types of diagnosis that a person can do. Okay. The first diagnosis that we do is should always be based on symptoms. Okay, generally many people make this mistake. They'll just send this one tongue the tongue photo, and they'll say, okay, sir, what is the protocol to be applied? It never works like this. Okay, your first diagnostic method should always be symptoms, and then to confirm, or if you have any doubt, okay, like there is symptoms which are conflicting each other, okay, in those situations you will have to take the help of the tongue. Okay, so always symptoms comes first and tongues comes later. Okay, and there are some cases where, like in minority, okay, majority is symptoms and minority is, there are some cases where tongue tells you a lot than the symptoms. Okay, patient will not be able to express all the things, but the tongue tells the truth. Okay, so tongue tells a lot of truth. Okay, and many a times patient will try to hide few things from you, but as soon as you see the tongue, the tongue will tell the truth, what is happening inside the body of the patient. So always you should make a practice that you should first list down all the symptoms, and then you should take a look at the tongue. So your full diagnosis should involve the symptoms and then the tongue. In tongue is relatively easier to learn. Okay, relatively. Okay. Say if you go to pulse diagnosis, etc., it is a more fine art, okay, where you understand how the pulses are moving in the body. So it requires more practice. Okay, and you will have to have the patient in physical so that you can feel the pulse. But tongue is something which you can see in physical and also through photographs. Okay, you can make a reasonably good judgment based on seeing the photographs. There are some devices which have come up where it which reads the pulses also, and it gives, pulse is nothing but a wave, right? So you see how the wave is, if the amplitude is too high or too low. There are different aspects through which those machines understands the pulse and creates a chart out of it. So we will not go into the pulse diagnosis. We will stick to the tongue diagnosis. And for you to understand the tongue diagnosis, you will have to have a proper grip on yin and yang. If your grip on yin and yang is less, then your grip on tongue diagnosis will also be less. Then your grip on the TCM symptoms, the protocols, standard protocols which are there, the patterns which are there, even in that your grip will be less. Okay. For you to become a good tongue diagnosis person or a therapist with good tongue diagnosis ability and good pattern recognition ability, you should have a very strong hold on yin and yang concepts. Okay. If you don't have it, then you will probably struggle. Okay. All those students who attended the books to brain classes, like I have taken elaborate time to explain just the yin and yang concept. How many of you feel that your hold on yin and yang is still not strong? Can you just show me your hands? Click on that show hand, raise hand button. Seven of them feel that their yin yang is not strong. Okay. So probably in the next class I will delve a little bit on yin yang, and then I will go into the details of it, because without that it is very difficult to grasp it. Okay. Why tongue diagnosis? It is relatively easy and it clarifies. Yeah, so revision, we will do a small revision in the next week's class, so that everybody are on the same page. So tongue diagnosis is relatively easy and it helps you to figure out what is happening when there is confusion in the symptom on what to choose. Okay. So first we will try to understand what the tongue is with respect to allopathy. Okay. So the Western sciences, and we are very fortunate that Dr. Revati is there in our class. So Dr. Revati is a dental surgeon. She is practicing for more than 38 years. And invariably, she has to take a look at the tongue every time when she has to look at a patient's teeth. Okay. So I invite Dr. Revati Suresh to take up the tongue part as per allopathy. So she will be the best person to teach this part. So I requested her and she graciously accepted to take this piece of the session. It's Dr. Revati. I will.
Thank you, Krishna. Good evening, everyone. This is nice to connect to everyone, and I hope I don't dilute the session, because it is my perspective every day in and day out. As the patient comes in and opens his mouth, before even seeing the teeth, I'll be seeing the tongue. And the natural tendency of the patient is to bring out the tongue. Then I have to tell them, keep your tongue back. I'm here to see the teeth. So this is like an add-on for me, learning about tongue and tongue diagnosis. I'm able to see the patient as a whole. Okay, now I'll stick on to what I'm supposed to be telling. Now, the tongue basically shows how relaxed the patient is. Any dental procedure that we do, there's a lot of high-speed machinery that we use, and the patient needs to be really relaxed. And any procedure, the tongue is our first enemy or friend, I will say. If it's a small filling, small cleaning also, the tongue keeps on moving there and trying to check what is happening in my territory, what is new, and it will not allow the procedure to be done peacefully if the patient is anxious or if he is having doubts about the doctor. It shows, it actually reflects the confidence he has in us. So before even touching the patient, we need to relax the patient and basically take care of the tongue, and then only start with the teeth treatment, because it invariably is there. One side cheek, one side tongue, and then we shouldn't injure those soft tissues when we are doing these procedures. So it is, I've been fortunate with this acupressure knowledge. I'm able to see much more than any dentist would generally do. Or rather myself, before even joining the course, my vision was very, very limited. And now I'm able to see the patient as a whole. So thank you to the entire team, acupressure, whoever taught me. Shall we just go straight to the anatomy part of the tongue?
Sure, man.
Yeah.
You let me know which slide that I have to use.
These pictures are easily available for everyone. Now, tongue is basically no bone structure. There is no bone. Any part of the body, you will find muscles or tendons which run from either, bone to bone connections, muscle and bone connections. But here it is muscle to muscle connection. Like one end will be on the bone, the other end is on the tongue. These voluntary muscles, this is basically controlled by your own willpower. The tongue is under your own control. So if the patient wants, he can make my procedures easy by controlling the tongue and giving space for me to work. Or if he doesn't want to, like children and all, they'll close the lips, but adults also do that with their tongue movements. Now, muscles of the tongue are basically two types, intrinsic and extrinsic. Intrinsic, it's all within the tongue, and the extrinsic ones are the external muscles which run from the either from the chin area to the tongue, from the throat to the tongue, from behind the skull to the tongue. All this is to give various movements for the tongue. Tongue is not only for tasting and swallowing. It has got different functions like speaking and then making the bolus out of your food. Whatever you are eating, the teeth are doing the chewing function, but basically mixing it up with the saliva and then chewing on either sides and converting the food into a bolus is facilitated by the tongue. And taste will improve your gastric secretions. That helps your digestion part of it. Swallowing needs all these muscles to work together. So basically the external muscles are genioglossus, hypoglossus, styloglossus, and palatoglossus. These are all just medical terms. Don't worry about all this. Genius means it is in that chin area. From the chin, it will go to the tongue. Hyoglossus is somewhere in the throat. From the throat to the tongue, you can see those mouths moving there. Styloglossus is from the behind the ear, it will go. Palatoglossus is upper jaw in the, it will go to the tongue. So these are all basically all the muscles which are helping in the swallowing and all the various tongue movements. I hope I'm not very fast. My speed is all right? Can I get a feedback? Am I on the same page? Hello?
It is fine for me, madam. Others?
Acha.
Okay.
Just let me know if I'm too fast, because I'm not going into depth. It is just to understand the basics. So these are the internal and the external.
Sorry to interrupt, an announcement. Those who are new, the session will end in another about 8 minutes. Once the session ends, we have to rejoin using the same user ID and password, okay, without any break. You just rejoin once again and then we will continue. Sorry, madam, go ahead.
Yeah.
Should I
now,
switch?
Like any other, now we can go to the next slide, like the nerves and the blood supply. Now, this tongue also shows, as an allopathy doctor, it shows the connection of the tongue with your brain functions. How is it connected to the brain function? If your elderly patients, if you see, or a patient who has had a head injury, the talking is affected. And then the swallowing part is affected. They will prefer to have just liquid or they just want to swallow. They don't want to chew and use the tongue so much. This is happening because the tongue has got supply from 1, 2, 3, 4, 5 of the cranial nerves. There are totally 12 cranial nerves. Of that, 5 of them are helping in movement of the tongue. The tongue has various movements like rolling from the sides, like this, protrusion, taking it inside, touching the top. All these movements, each nerve takes care of the tongue movements. Why so many movements are required for the tongue? This is because it requires all this when it is swallowing, when it is helping the bolus formation, plus when it is also speaking, helping in speech. If these movements are not comfortable or not to that extent, we can suspect some interference with the brain system. That is one aspect of it. They normally see the anemic condition by seeing the tongue. The blood circulation is very superficial on the tongue region, especially the back of the tongue. If you roll your tongue, you can see some arteries and veins. So it shows us the anemic conditions, whether the blood is having, that much of hemoglobin, what is the quality of your blood. So it can also shows the hemoglobin part of it. It shows the nervous functions of the tongue. It shows your alertness of your brain. And it also shows your digestive powers. The saliva is there, your teeth are there, but if your tongue is not moving the food properly, then that bolus formation doesn't happen. So all these are the basic things. The nerve supply, hypoglossal lingual nerve, facial nerve, glossopharyngeal nerve, internal laryngeal nerve, all these they are group of nerves which directly connect from the brain to the tongue. More detailed information is of course available in the net. You can go through that. And the blood supply, as I told you, it is branch of an external carotid. Carotid artery is a main artery which goes and supplies the brain. So a branch of that will come and supply the tongue. So if there is some interference in that area, it can be seen in the tongue. Then as usual, there is a lymphatic drainage. And any part we require, all the defense mechanism is in the mouth. Basically, all the tonsils, the part of the tonsils which is part of the lymphatic system, they're all present in the tongue. This is very, very important function because expressing oneself is also happening through the speech. And if your speech is not coordinated, it can reflect, you're not able to express. So communication becomes a problem. Breathing is another aspect which is very important. Some people have a little larger tongue than the space available. So the larger tongue can block the airway. And if there is a nasal block, if there's already a nose is blocked and there is no way to breathe, you get something called sleep apnea. Sleep apnea is when suddenly, there's no air is going and then suddenly you get up and you breathe well and then you go back to sleep. It becomes a subconscious thing. Patients don't even realize they have done that. So the tongue size, shape, the movement of the tongue, the functions of all the various functions of the tongue, these are all very, very important for a healthy human. Earlier days, they used to only see the tongue and arrive at various conclusions. Even before touching the patient, they'll ask you to protrude the tongue, see the eyes, and nails, and these were the basic things to find out what's wrong in the system. I think this is enough. I don't want to dwell more into this. Any doubts later on? After your session is over, we can cover up in case somebody has any doubts.
Thank you, ma'am. Thank you very much.
Thank you.
So there are few things which I just want to touch upon. So this is the root of the tongue. Okay, so we will get to listen these words quite a lot. And this is the body of the tongue. And this is the apex, the tip of the tongue. Okay. So now I would want to get into the TCM aspect of the tongue. How do we understand the tongue? So we all know that we have three burners, okay, triple warmer. Okay. The lower burner, the middle burner, and the upper burner in the body. So the same is there in the tongue also. There is upper burner, middle burner, lower burner. See, if we see our body system, okay, we have the lungs, heart, and pericardium in the upper warmer, spleen and stomach in the middle warmer, and gallbladder also. And in the lower warmer, we have our intestines, kidney, urinary bladder, and liver is also shown in the lower warmer. The only thing, the difference between this and this is, if you invert the body. So now everything falls in place. So the organs which are in upper burner, okay, whatever is in the chest cavity, that is your lungs, your heart, and your pericardium. All these three things are seen in the upper burner, and your digestive organ, that is mainly spleen and stomach, are seen in the middle burner, and also gallbladder and liver. You can think in that way also. And in the lower burner, we have our intestines, okay, the small intestine, large intestine, and kidneys. Okay, so these come in the lower burner. So the whole body, how it is structured, the similar way our tongue mapping is also structured. Okay, if you just invert the body, the whole thing flows like this. Okay, so we have just less than a minute. So now there will be the session will get disconnected. So we'll have to rejoin the session with the same user ID and password. Next. Okay. We were discussing that the human body, the tongue, and the human body's organs, they are all placed in a similar manner. Okay, you just have to invert the body. Okay, so it flows. So now we will try to understand the plotting of the body little bit more in detail. In Ayurvedic acupressure, many of you would have learned something called as specific and generic. Okay. So there is a general way of treatment and there is a specific way of treating. Right? So similarly, when we try to understand the tongue, there is a generic way of understanding and there is a specific way of understanding, or there is a general location of the organ and specific location of the organ. So this is a very, very generic level of division. Okay, the upper area will contain the heart, lungs, and pericardium. The middle will contain your liver, gallbladder, and stomach, and the lower burner will contain kidney, small intestine, large intestine, etc. Now, if I want to observe the tongue more specifically, in more detail, then there is different levels of segregation and each of them are used in different scenarios. So now if I go one step detail, this is the first level of detailing. Okay, so here the tip is heart. Okay, and the left, this area and this area is allocated for liver and gallbladder. The central area is allocated for spleen and stomach, and the the root area is allocated for kidney. Okay, so here We don't have intestines, we don't have lungs. So this is first level of detailing. From very generalization, we have got into first level of detailing. And if I go one step more in detail, okay, now this area, central area, is both spleen and stomach. But which one is spleen, which one is stomach? If I have that kind of question. And on the left side, if you see, there is here also liver and gallbladder is there, and here also liver and gallbladder is there. Now, which one is gallbladder, which one is liver? Okay, if I have that question. Okay, so this one level of detailing, if we go, then we will arrive at this mapping. Okay, so this area, the right area is spleen, the left area, the person's left is stomach. Okay, and the tongue body, whenever I am saying left or right, it is related to the tongue, not you, the who is seeing, it will be opposite for you. So on the right side, it will, this area depicts the gallbladder, and this area on the left side depicts the liver. Okay, and the bottom area is the heart and pericardium, and if you go one step above that, it shows the lungs area. And the other intestines, etc. Okay, the urinary bladder, kidney, large intestine, small intestine, all of these are clubbed towards the back. And there is something called Mingmen. Okay, so we will try to understand this a little bit later. Okay, if I want to get into the further details of it, okay, all of these are clubbed. Now, if I want to get to know where small intestine is, where large intestine is, okay, within that common area, if I want to become more specific, it is, if you can take a look at this map. So here you can see the differentiation. Kidney is at the back and the bladder is in this area, and to the right it is small intestine, and to the left it is large intestine. So you become more specific, you plot the specific areas. Okay, and then if you want to become little bit more specific, or a different way of seeing the things, okay, this is probably the most one. Here the pericardium is not indicated, but in this one you once again kind of see liver and gallbladder as in both the places, the same here, but you add pericardium and the other way of specifying the organs. So it is mentioned over here. Generally, we tend to use this one. Okay, this is kind of our standard way of seeing things. Okay, and also we also can use this when we are trying to generalize more. Okay, so when you see a tongue, first you see generically on what is like superficially, you try to understand few things, and then you go into few levels of detailing and try to understand the specific things. Okay, you do both of it. Okay, so you will understand this when we take up those different cases, etc. You will understand what to see first, what to see next, for which we have to give more specific attention, for which we can skip. All those things you will understand later. But this is how the human body is mapped onto the tongue. Okay, we all know how the human body is mapped onto the palms, right? In a correspondence system, how things are mapped, we all know. Similarly, how the human body is mapped onto the tongue. So which area, okay, each of, if there is something happening in this area, okay, then I can understand, okay, it is liver, gallbladder, and if there is anything specific, then okay, probably gallbladder is having issue. And on this side, you can understand there is some problem if there is stasis. Okay, you will understand all these vocabularies little later. Liver blood stasis, you would have understand. Okay, some people will have stasis marks over only on one side. Some people will have generically on all the sides. So in this way, you will be able to understand where the blood stasis is happening, etc. Okay. So this is about how the human body is plotted. Okay. So I'll quickly bring the human body over here and paste it. So invert the body. The first burner has lungs and heart and pericardium. So you will see lungs, heart and pericardium. Okay, this is the first part. Then you go a little deeper into this area. Okay. Here you will see stomach, spleen, liver and gallbladder, this area. So the next area you are seeing the same thing, stomach, spleen, liver and gallbladder. And next, if you go to the lower burner, you will see the intestines, the kidney and the bladder. Okay, so the same thing is over here. Kidney, large intestine, small intestine and bladder. Okay. One more addition thing is Mingmen. And what is, this should be pretty straightforward. Don't get confused too much. Okay, if you don't understand, just try to keep these two things, these two charts which are in the middle, you try to keep them in your mind. Okay. Okay. We discussed about Samanya and Vishesh, the way that we discuss in Ayurvedic acupressure, right? Samanya is generic way of seeing. So this generic way of seeing. Vishesh is specific way of seeing, where we identify each organ and its own specific places. So these are all, the more and more you become Vishesh, the more and more specific you get. So what is this Mingmen? We will try to understand that. So Mingmen is gate of vitality. It is a very important concept. So it is on the back side of the umbilical. Whatever our Nabi is there on this area, so it is behind that. It is where our GV4 comes. Okay. And it is between the two kidneys. Okay, that is where the gate of vitality is present. Okay. And they have plotted that gate of vitality for the root of the tongue. It is a very important thing. When we see the tongue, we see the vitality of the tongue, how lively that tongue is. Okay. How much life is filled within that tongue. Okay. If somebody's tongue is filled with life, it has good spirit, but there is some disease in the human body, it means that the prognosis, okay, the ability of recovery is good. Okay, the person will be able to recover fast because there is a lot of life in the tongue. Okay. But some tongue, if you see, it shows lifelessness. It will be like this. Okay. The tongue is not proper stiff. It is kind of very flaccid and lifeless. Okay, latka hua kind of thing. Okay. So now here the life in the tongue is less, means the life or the spirit in the body is also less. So you would know kidney essence. Okay, as we progress in our life from young age to old age, what is happening? The kidney essence is becoming less and less and less. So what is happening? The essence in the body is becoming less, and the spirit, the life in the body is also diminishing. And the same diminishment is reflected in the tongue. Okay. And you see the tongue, somebody's tongue, even though externally they may be looking okay, the disease may be hidden, but the tongue is very lifeless, no? Just a sagging kind of thing. Then you can understand, okay, the spirit or the life essence is less in that person. So that is, and where do you notice that is at the root. Okay, how much the root is like filled with life. If the root is lifeless, then the essence, okay, is gate of vitality is low in that person. That is the importance of Mingmen. Okay. So next, when we have to observe a person's tongue, there are few things that we have to keep in mind. Okay, we cannot just see the tongue in any way that we want, because it will not give you the right depiction. So we say black and white, and between black and white there is gray, and there are different shades of gray, right? So there are different shades of some color. So we will have to observe all those different shades of the we will in the next class we will discuss what all we will have to see: the color of the tongue, the color of the coating, all those, in which area which color is prominent. If we have to see all of those things properly, then lighting is very, very important. Okay, if our lighting is wrong, if it is insufficient light or wrong type of light, then we will miss out on those different shades that we will have to observe. Okay, so what is the type of light that we have to use while observing the tongue? The best is the sunlight. Okay, if you have access to the sunlight, like if you can take the patient next to a window where there is sufficient light and see, that is the best option. If you don't have that option, then incandescent light is preferred. The old styled bulb, incandescent bulb, that is next preference. What is to be the least preferred type of light is fluorescent kind of light, the LED lights, tube lights. Okay, these kind of lights are to be avoided. If at all there are no options and you have to use a fluorescent light, then it is better to use those lights which are full spectrum lights. Okay. So I was telling that which light to use and which light to avoid. Okay, so better to avoid these fluorescent kind of lights, and if at all if you have to use them, use the full spectrum lights where it gives out all the entire range of light spectrum. So in that full range you will be able to see all those different shades. So what happens when you use those fluorescent these kind of lights is that it kind of washes out, the light washes all those subtle variations and you will not be able to observe them. Okay, so this is one very important things. Okay, because if we have to see in liver area if there is fire, okay, then it has to be more redder than compared to other area. If there is heart fire, then the heart area has to have more redderness compared to the other area. So this area, say for example heart fire blazing, so this heart area has to be more redder than the other parts of the tongue. So you have to see the shades, different shades of that red. But if you have a fluorescent light, all of them will look very similar, so you will not be able to spot the problem. Okay, so it will miss out. Okay, so that is the reason that you have to have this proper lighting structure. So, and I had once visited, say, Ravindra sir. Many of you know Ravindra sir. No? He was using old kind of torch. Okay, you all know old. We used to put those thick batteries, okay, and switch on. So then I was thinking, why sir is using this old kind of torch instead of a modern LED one. So many of them come, no? So then while I was understanding, no, then I realized why the old style torch was used to do the tongue diagnosis, light the tongue, because this gives you a better picture of the tongue compared to the other one. And the second aspect that we have to keep in mind while observing the tongue is when we ask a patient to show the tongue, okay, we should ask them to stretch it fully and not hold it for more than 5 seconds. Because when the tongue is stretched for longer duration, what happens? The blood supply starts happening to the tongue. More blood is supplied to the tongue, okay, because you are extending the tongue. Now, when more blood is sent to the tongue, the shades will once again change. Okay, the differences of shades that I have to see, that will kind of become normalized because more blood is rushing into the tongue, and all those differences will reduce. And even then, we will not be able to spot the problem areas. So it is always suggested not to see the tongue for more than 5 seconds at one stretch. So if you feel that you have not got all the information that you require, ask them to close the tongue. After some time, you ask them to open it once again. Okay, so you make your observation. Okay, and then if you feel that you have not figured out what to spot, then you ask them to close, and then ask them to after a few seconds you ask them to reopen. So in that way, the proper blood supply is maintained, normal blood supply is maintained to the tongue, and it will still show all those different shades, okay, the differences that we are expecting to see. Okay, so this is one thing. And this is in terms of duration. And next is, try to avoid seeing the tongue after a meal. Okay. So if the patient has just consumed some meal, okay, or a tea or coffee, what happens? The color of the meal, okay, would have influenced the color of the tongue. Okay, and if somebody has drank some tea or coffee, that layering would have, the color would have changed. Okay, and if somebody is having betel leaf, pan, bida, and those kind of things, even then it is advisable not to make judgments of the patients or make judgments of the diagnosis based on those tongues which are influenced by the meal or any of those edible things which have been taken. Somebody will say eat a toffee, okay, it has orange color or black color or any of those colors, and if you see the tongue, you can't make out that. Okay, so in those kind of things, the situation, you can ask the patient to wash the mouth and then show it, or it will still not be the best thing, because it will still retain those coloring agents will still be there. So it is better to give an hour or 2 hour gap right after the meal, means after the meal, and then see the tongue. Okay, so, and what is the best time to see the tongue? Okay, the best time to see the tongue is as soon as you wake up. So as soon as you wake up, like, your tongue will be well rested, and whatever it would have not gone through any physical movement, any work, etc. So as soon as you wake up, the first thing, before drinking water or before washing your teeth, mouth, brushing your teeth, before you drink coffee, tea, before any of those things, you wake up and go to the in front of the mirror, stretch your tongue and see it under proper light. So that gives you the best perspective of the tongue. It gives the best image. So like as you go through the day, what happens? There is a lot of change in the emotions. So those change in the emotions will bring about change in the tongue. Okay, the equilibrium of the tongue will be changed based on, say you become angry. Okay, somebody, you are angry for some time. When you are angry, what happens? There is more rushing of the blood. Okay. So the tongue color will change. If you are under fear, psychological changes, or if you just worked out, okay, after you went to gym or you went for a walk or jogging, or you climbed the stairs and you came up. So the tongue is not in the equilibrium state. But as soon as you, like after you have rested well, and in the morning, the first thing that you see is your tongue, then the tongue will be in its equilibrium. So that is the best time to see the tongue. Okay. So these are some of the precautionary things, or few things that you have to take into consideration before observing the tongue. Okay. So these were few things which I wanted to share in today's class. Based on today's class, okay, anybody has any questions? So we can take up, we have another 10 minutes, so we can take up the questions.
Can I?
Please.
So,
Yes.
Pallavi here.
Yes. Pallavi Mehta, right?
Yes.
Yes, ma'am.
Like for example, if the patient comes to us at the clinic, say my clinic timings are 2 to 5. And when they come there and I have to check the tongue, like at that hour. So either they have just had something because it's lunchtime, or if they're coming at 5, they must have had the tea. So in that case, what can we do? We have to go by whatever is.
The best thing is when they take appointment, you have to inform them to avoid to consume anything. Ask them not to consume anything at least 1 hour before the visit. Okay, 1 or 2 hours the visit. Like if they are trying to come in the afternoon, either they should have their lunch after they visit the clinic, or well before, like at least 1 or 2 hours before, that you have to inform them. That will be your duty. And second is, if you have any wash area, you can ask them to rinse their mouth and then take a look at the tongue. So it is better to see that way than with all different coatings of the food. So when you have no other option, it is you will have to make some educated guesses. So so it is from best to not so best option. You have all those things.
Okay, sir. Thank you.
So
Krishnamurthy,
yes,
now that liver and gallbladder, when you said it's on the sides, you are talking only about the front aspect of the tongue, or does it go on the sides also?
It also goes on the sides. Okay, when you observe some patients who are having the stasis, okay, when you see from the side, even on the side area also, it will be the stasis mark, purple mark color you will see. So sometimes it is only on the top surface, and sometimes it is on the sides also.
So do we ask the patient to do the side movements also? It is better to take, so you yes, either you can ask them to turn the tongue head and show them in this way, or you can ask them to do the tongue on the sideways. So you will have to observe the tongue in all the 4 places. You have to see the top, you have to see the bottom like this, and you have to see the sides. Okay. So all 4 areas you have to see, and not only what is extended, you have to ask them to open the mouth and see the back also. You have to throw some torchlight, or you have to
face them in the proper light direction, and you have to observe the entire tongue.
Yes.
Okay.
Okay. Thank you.
Any other questions?
Sir,
Mhm.
only top of the tongue alone is not sufficient. Bottom of the tongue also should be seen.
Yes, because bottom also gives you some information. We will discuss what kind of information the bottom gives. So it is, you will have to observe both top, bottom and sides of the tongue, because generally sides will be visible when you see the top also.
Yeah.
Sometimes
Yeah.
it may not be visible. So you can ask them to, especially if you are trying to see the thickness of the tongue, etc., then you have to ask them to see, show it sideways. Okay. But bottom, when you see, you can get to, if you are missing out, say, liver blood stasis is happening. Okay. It is a process. First liver key stagnation happens, and then slowly the stagnation happens, and the level of stagnation is slowly increasing. So it depends on when the patient comes to you. If the patient comes when the stasis has happened well properly, then you can see it on the tongue. But if it is still in the process of transferring from liver key stagnation to liver blood stasis, then if you see on the bottom of the tongue, you'll be able to see those purple colored veins. Then you can make out, okay, the stasis has started happening.
Okay.
So it will give you the better picture. Okay.
Okay. Thank you, sir.
Welcome. Okay. So
this is Praveen.
yes, just give me a moment. Yes, KP. What is KP?
Kilar Praveen ji.
Praveen.
Sorry.
Yes.
Ji, one small.
Can you, if possible, show me your face? I think this is the first time I'm meeting you. Like those students who are. Okay. Yes, sir. Tell me.
Ji, this one in first in this horizontal, liver and gallbladder both are there in sides of tongue. But in second one, in that gallbladder in one side and right side, and liver is just left side. What is the difference between these two types of images?
Okay. See, this gives a general area, like liver and gallbladder functions very closely within. Okay. There is a lot of dependency between them. Okay. And there are some situations where there is a situation where there is, for example, humid heat in liver and gallbladder. If we say that humidity has increased both in liver and gallbladder, okay, that is a situation. Then both
like
the sides,
fatty liver.
Yeah, so both these sides will be kind of swollen. Okay. And for example, if there is only stasis in liver, then you will see only this area being dark. Okay, that purple area. So there is no stasis in gallbladder area. So that is how you differentiate between when to look for liver, when to treat only liver, or when to treat both liver and gallbladder.
Okay, ji. Yeah.
Okay.
Thank you.
Make sense? Are you clear?
Yes.
Or still not clear?
Yes, ji.
Achha?
No. Your explanation always clear.
Okay, great.
Yeah.
So next is who? I think Priya.
Yeah.
Yes.
I had asked this question.
Yes. Yes, madam. Tell me.
I wanted to know. I see the spleen and the stomach in this picture. What about the pancreas? That's also in the middle burner layer, right?
So whenever we
that
say
cannot be diagnosed.
No, you are in which semester? I forgot, Priyaji.
I just finished my second.
Just finished?
With the second semester.
Second semester, okay. See, whenever we say spleen in TCM, it also involves pancreas. Okay, it is, whenever we say spleen, it is pancreatic functions. So whenever, say, if you have in third semester, you will get to know this when you do Dr. Wall's. So like we know that spleen meridian is bilateral. It is flowing on both left side and right side. So what Dr. Wall has done is he has segregated. Okay, left side is pancreas, and right side is pancreas, When we treat pancreas on the right side, and on the left side we treat spleen. But when we say spleen, it involves both pancreas and spleen. But if you have to be specific to treat only pancreas, then you will have to choose the right side of the spleen meridian. So that has more effect on pancreas. Make sense? Clear?
Yeah. So in case I'm like doing a diagnosis based on symptoms and the tongue observation. So for a review when I'm going to do, I understand definitely based on the disease level and all, it will change, can be reflected on the tongue. Correct?
No, I could not hear. Your voice was very feeble.
Can you hear me now?
I can hear, but those you have to speak little louder. You have to raise your volume.
Yeah, no, I was saying that.
Okay. Before we continue, there is just 1 minute left. How many of you have questions? Let me see. Raise your hands. Binduji has asked one question. Rafika Begum has asked another. Okay. So what we will do, the session will
Yeah, I'll
end
hold
now.
on. Yes.
No, the session will end now. We will rejoin. The session will end now. We will rejoin and take the remaining questions. Okay. Okay. So now I think session will just end. We will rejoin and take up the question. Continue with the question. Okay. Luckily, yes, Priya madam, you can ask your question once again.
Hello.
Yes.
So when we do a diagnosis, definitely based on the level of disease or the duration that the person has been having the symptoms, we will need to see. So how often do we again do a review or to be shown on the tongue again?
Okay. The question is, if the disease is kind of progressed, when will it show on the tongue? That is the question.
Yeah, I mean, basically, whether my protocols have helped the person, is it getting reflected? The symptoms may change, but we always know that the tongue has a better picture. So,
Okay. Always, the first priority is symptom. My treatment is always, I have to treat the symptoms. Okay. But if I am not able to decide which protocol to use, okay, what is predominant in the body? Okay. Say if there is heat symptom in the body, okay, the person is feeling very hot. Okay, now it can be either full heat or empty heat. You will probably, it was taught to you in the second semester on full heat and empty heat or humid heat. There are 3 different types of heat. Now, what type of heat is there in the body? If I want to decide, then the tongue will help me to some extent. And if there is heat in the body, but where the heat is present, is it present in heart? Is it present in liver? Is it present in intestines? It is present somewhere else. If I want to understand, then the tongue will help me. Okay, the patient comes, and as soon as the patient comes and sits in front of you, the patient will say, I'm feeling very hot. Could you please switch on the fan? That is a telltale sign. As soon as somebody asks you to switch on the fan, or the patient will come and ask you, can I have a cup of water? If they ask water, then all of these things are a sign that there is heat in the body. Okay. Now, where is that heat present? Is it present in the heart or liver? Okay, if I want to make that kind of distinction, then the tongue will help me. Right? So if your question is, should I look for symptom or just look for tongue? first priority is always symptoms, and there are some cases when tongue will take precedence over the symptom. For example, somebody is having stasis in the blood stasis. The blood is not moving properly. Say, for example, in liver, easily you will get that. So liver is holding the blood, right? That is like a sponge. So it is holding the blood, like about 1.5 liters of blood is held in the liver. And that blood is supposed to move properly within the system, right? Now, if that movement is not happening properly, if the blood is kind of stagnating, then you will see those purple spots in the liver area. And if the same blood is not moving properly in the heart, in the coronary arteries, everywhere the blood is supposed to move properly, freely. And if there is kind of stagnation happening over there, then those purple spots will come in the heart area, right? It will come over here. And if it is in liver, it will come over here. If it is both in liver and gallbladder, it will come in both the sides. That you will not be able to figure out from symptoms. Like, say, if there is a blood stasis in heart, if the patient presses the heart area, okay, then there will be a stabbing pain, but it will be figured out only when there is if you palpate that area. If you don't palpate that area, the patient will not say that there is pain in heart. So you will not be able to figure out by symptoms. In those specific situations, then you will have to depend on the tongue. Okay, I can say 80% symptoms, 20% on tongue. In 20% of situation, you will have to depend on tongue first, and in 80% of situation, you will have to depend on symptoms first. Makes clear?
Yes, sir.
The way I understood Priya's question was, now I have already made diagnosis, I have given a protocol. Now how quickly will the tongue show that I'm on the right track? Will it happen quickly,
Yes.
or will it take time?
Is
that right, Priya?
Yes.
Okay. If that is the question, then the change, depending on different circumstances, the change will occur in a different time durations. Say if there is an excess condition that you are treating, okay, if there is excess heat, so it may take 1 week. If the excess is mildly excess, then 1 week, 2 week, you will notice the change. If the excess is not mild, it is quite large, then it may take 3 weeks, 4 weeks kind of situation to time to show it. And there are some situations you may find it in few days. Okay, so it varies depending on the degree of the problem. The time taken to show on the tongue will also vary. Okay, but always you will have to make a note on how the tongue is. Every time the patient visits you, you will have to observe the tongue, and you will have to correlate, compare to how the tongue was looking last time. Is it moving well, etc. Okay. Answers your question?
Yes.
Who was the next person? I think, yes, Rafika ji.
Sir, some people have permanent black patches on tongue, no?
Yeah.
I mean, in those cases, how we can find out if it is permanent?
What I say is, like in our language, we say those moles which are there on the body is there, right? So they say there are moles on the tongue. In Kannada, we say mache, on the tongue. So there is no such kind of mole business on the tongue. Okay, if there is a mole on the tongue, dots, it is telling you something. Okay, if it is on the tip, it is telling there is hard blood stasis. If it is on the sides, it is telling you there is stasis happening. So it is not a mole, it is a condition which it is telling.
Okay, sir, thank you.
So you will be able to make it out as the more and more you see the tongue. If there is some kind of permanent patch which has happened, which could be for some other reason, okay, you can notice that it is different than stagnation, no, stasis marks, but generally it is stasis. Clear, Rafika ji?
Yes, sir. Yes, sir. Clear.
Yes. Bindu madam had a question. You had typed a question, Bindu ji?
Yes, sir. I had typed the question the same time Lakshmi asked the same question, sir.
Okay, fine. So your question is answered, right?
Yes, my question. But now what you're talking about the mole, no, sir? That if the mole like stays like that only during our treatment, if we say it is on the liver side and we start treating the liver stasis and all those things, and it doesn't change at all. So do you say that there is no mole business on the tongue, sir?
See, I have not come across a mole business. I have
No,
seen
I
patients.
remember my childhood friend. Now I don't, but at that time I remember that she had a black patch on her tongue. I don't know now. I haven't met her after that.
You will have to see where it is, and then you have
Huh.
to treat it and see, because many a times patients say that this mark is there for many years.
Many years. Yes, sir.
It means that their symptom is there for many years. They have not fixed it. So there is a high likelihood that when you treat, those things change. Okay.
Huh. If suppose it doesn't change, then we have to see what else it is.
Yeah, it is based on case by case. You will have to see why that is happening. Okay, it may be something else which is we'll have to see that.
Okay, yeah, understood, sir. Understood. Thank you, sir.
Yes, Anisha ji.
Sir, if someone has that uneven teeth and they have the habit of this scraping with their tongue, mainly the tip of the tongue, so will it make any difference? Like tip of the tongue will be redder or something like that?
No, repeat the question.
If someone has uneven teeth and the food gets stuck most of the time between the teeth, and they have the habit of, taking that out with their tongue.
Okay.
Mainly with the tip of the tongue. So will that make any difference on the tip of the tongue?
Yes. Basically, they are making work. No, they are giving work to the tongue. No, they'll do all these things. So the tongue has to do more work. So to do more work, more blood has to flow. Right. So for the duration, okay, say if the person is doing for 1 minute, okay, then for that 1 minute and probably for another few minutes, like 1 minute for the work, and after the effect of that work, probably for another 2-3 minutes. So you can see the changes in the tongue. The tongue may become more red because more work is being done through the tongue, and more blood supply is happening. So there will be change of the equilibrium. Clear?
Okay, so it will be for the temporary period, no?
Yeah, it will be just for the temporary period. For after 3-4 minutes, then the body has to, it will try to bring it back to the equilibrium, the homeostasis.
And another thing, I am confused with the root word. Normally we consider this as the lower burner, right? Root is the lower burner, but sometimes we read like it is the rootless tongue or something. Is it anything related to coating or something?
Yes. See, it is basically the way of saying it is, if there is a coating which is permanent, even after you brush your teeth and remove it from a tongue cleaner, that coating will not go. If that is a type of coating, then it is called a rooted coating. And by cleaning with a tongue cleaner, if it goes off, it is called rootless. Means it is just like a plant. You pick it up. It is, if there is proper root, you will not be pick it up. You will be able to pick it up. If it is loosely rooted, or if the roots are not strong, then it will easily come out the plant. So similarly, that is with the coating. So you don't have to confuse between those two. It is,
Okay.
this is in terms of Western, allopathic way of saying the the posterior part of the tongue is called as root. But in terms of coating, is it there for longer time or it is very easily removed? That is the difference. Clear?
Yes, sir. Thank you.
Okay. Anybody else has any other question?
G, this is KP.
Mhm.
In previous image, you shown some horizontal 4 type of images. That same thing. I have one more question.
What is that? Which image? This one?
No, after that I have this one. There is a 4 type of configuration in this one. In one place, lung is there, and in some other place, number of organs are different. Example,
Yes.
kidney is there, kidney Mingmen in one, and LI, SA, and bladder. 3 combination is there. In next image, actually the places are different.
Yes.
Bladder and LI, SA. It's testing.
Yeah. So it is there is some concept called generic and specific. Okay. Say
Okay.
who all are there in this class? Okay. All of them are students. Okay. So that is one generalization. Students are there in this class. If you want to become more specific, how many men and how many women? So you separate men and women. Okay. And
Okay.
even in men and women, you can separate it in another way. How many of them are graduates? How many of them are, say, postgraduates? So there is another type of segregation. So similarly, it is one level of generalization. This entire area, it is related to kidney. It is very generic, but you go little bit specific. Okay, what other than kidney? Okay, these all are there along with kidney, but where they are each, so then you segregate them, more further segregation. So LI is here, SI is here, kidney is in the back, bladder is little front. So you give more specific locations to specific organs.
Okay.
Making sense?
The heart, yeah, at the tip of the tongue, heart generally most I see some places, but in this image, the heart and pericardium both are there.
Yeah, heart is there, and around the heart there is pericardium cover, right?
Yeah, of course. Yeah.
So generally, if you want to make any diagnosis, say if a patient, when the patient gives some symptoms, and based on those symptoms, you think there is something going on in the pericardium. So then which area should you look? Okay. It has to be just around this area is heart, and the pericardium is covering the heart, around this edge. So you will have to see that.
Okay.
Okay. So this,
Yeah, okay.
this area, pericardium, because it is covering the heart. So this whole area, it is like this covering the heart, and this area is all heart.
Okay.
So these are all very, very subtle things that you will have to keep in mind.
Okay.
Yes, Binduji.
But at the same time, stomach and spleen, in first image, actually it is up and down, but next image it's side by side.
So this,
and third image is actually, there is such an area for stomach and spleen.
This is the stomach and spleen in general. If you want to see the middle burner, this is there. But if you see some variations within that area, then if you want to specify which is spleen, which is stomach, then you have to look into this area. Okay. And this is the generalization, like whatever is shown, say there is empty space here, right? So what do you allocate these empty spaces for? So they have used up those empty spaces also to show stomach and spleen.
Okay.
Okay.
Yeah. Okay.
So
will you share this one in video recording?
I will give the video recording, and it has to be only used by those who are in the class.
Yeah, of course, of course.
Yeah.
Because beginning actually I'm not there, so I can see the recording.
Yeah.
Sir, may I ask?
Yes, please.
Sir, these three burners where we divide the tongue, are all these three burners equally proportionate, or is there any difference, like the upper burner is smaller, middle burner is larger, and again the lower burner is smaller?
See,
Is there anything like that?
This is not a rectangle, right? So in terms of, if it was a rectangle, then probably we would have got in terms of areas, it would have been equally distributed.
No, not area, that line, sir. Dividing line, dividing line. That proportion I'm asking, not the area, sir. Area cannot be, because the tip will be smaller. Anyway, it will be smaller. The root area will be larger.
We can say the lower burner will be slightly larger than the other burners. We can say that.
Not the area wise. Sir, I'm not asking the area wise.
No. I'm telling you this length.
Okay. Length.
Yeah.
Is that length equal for all three burners?
It is supposed to be very similar. Okay, but we can say that lower burner may be slightly having larger length. Because the root is there, going till the back.
Yes.
So because of that, we can say that it has slightly larger length allocated for it.
But see, sir, none of the pictures it is shown like that. The middle burner is shown as such a big area, lengthwise.
See, when you see the tongue.
All the four pictures.
See, when you see the tongue, the back side has a large area. And it is generally not seen. I'm not talking about this horizontal thing. Even the vertical one, see, if you see these images, there is a lot of area present in this one. This area. Which is generally, it is towards the back and it is not easily seen. So with that concept, we can say that it has slightly more space.
So the middle burner and the upper burner will be equal length.
More or less.
I am not talking about the area at all. Length, basically the length.
Yes.
So when we see the tongue, it is like the apex part we have to take it at least 1/3 of the tongue.
Yeah. You divide, what the book says is you divide it into 1/3. Divide it into
1/3,
1/3.
Okay. Because the pictures they show the middle burner as a big area.
See, the more you try to see the tongue, the more tongues you see, you will not have these kind of confusions.
Okay, sir. Okay, sir. Thank you.
Okay. Any other questions? Okay. I think there are no questions. Fine. So I think we were supposed to end at 8:30. It somehow just went little ahead. Okay. One of the benefit, before we leave, I just wanted to tell you, we are having just one class per week, right? Generally when other teachers take the class, they just take in one go, either 1 week or 3 days or 4 days. Different people will have different durations for the class. So even if it is 1 week or 7 days, they will take the class one after the other and they will complete. Now that 1 week is now divided into 3 months for us. What is the benefit is, now every time I take a class for 1 week, you will have time, right? What is that you have to do is you have to practice what is being taught. Start seeing the tongues. Okay, observe somebody, your tongue, your family member's tongue, your friend's tongue. If you are practicing, you see your patient's tongue, take a photograph, try to analyze, okay, and build up your questions. And when you have those questions, we will discuss after that one week's class. So this is a benefit that you will get. Okay, when you are going through a series of questions, you will not have the time to ask those questions, do your work, and if any doubts, go back. Those options will not be there. Now, because it is spread out for whole 3 months, you will have plenty of time to do your homeworks, see tongues, do the analysis. We can take a lot of case histories, those kind of work we will do. And also I will do my reading work from different books. I have purchased quite a bit of books. So this is one book. Okay, and this is another book, Tongue Diagnosis, and this is an atlas of Tongue Diagnosis book, and there are some other books which is talking about diagnosis from Giovanni Masiosia. So how much ever I can take different contents from the book, I will try to take those different contents from the book and try to present it. So that is why I have taken 3 months time, so I can get an opportunity to read some of these books properly. Okay, and we also have our treatise 18. So I'll try my best to present the contents in a easily digestible way. And you should also do your work. You have to see tongues, understand what is happening. And if you have any questions, post it in the group, or you can ask it in the class, and we'll try to answer them. Okay. Fine. So thank you all for joining.
Can we post special tongue pictures in this group, tongue diagnosis group, or personally we need to post? Because
post it in the group, and also
so everyone can think about it. Yeah. Okay.
And you tell what is your diagnosis of that. So you should it should not be that I have posted a photo and asked me telling what is this. No, you will have to.
Yeah.
I'm not telling just for you, for everyone. Okay, if you post any photo, you will have to do some elementary level of diagnosis and tell, okay, this is what I understand from the tongue. Okay, this is like the tongue is red, the tongue is coating is white, the coating is yellow, there is some purple. Some level of diagnosis you have to do and tell in the group. This is what I've done. Then if there is any correction needs to be made, we will make it. Okay.
Yeah. Thank you.
The work is for both the sides, both the parties.
3 months we'll be only seeing tongue. That means very good.
Yeah. So, and if you have to brush up your TCM pattern diagnosis skill, you can do that also, because it is very, very essential. Without that, you will not be able to identify the patterns on the tongue. If you don't know what the pattern is, you can't identify the pattern. Okay.
Yeah. Thank you. Thank you.
And also try to make yourself strong in Yin and Yang fundamentals. I will try to take the class once again, but the more you have grip on Yin and Yang, it becomes much more easier to do those diagnosis. Okay, so I thank you all for joining. So we will see in the next week's class. Okay, have a good night.
Good night.
Thank you. Good night.
Good night.
Good night, sir.